My guest this week is my friend Dr. Don Williams. Dr. Williams, thanks for coming on again.
Thank you, Lou. It's always a pleasure coming here. And
it's a pleasure to have you. And this week we're going to be talking about something that's extremely interesting to me and a number of my friends who seem to have this problem, chronic fatigue syndrome, and what causes it and what cures it. So should we maybe review the 6 essentials and then go into chronic fatigue?
Well, sure, because one of the things I'm always looking at, no matter what condition someone comes in with, because we always have to remember that whatever condition that someone has is not a cause of their condition.
Right.
It's a name we put on the effects of their conditions. It's a collection of symptoms that you can put into a category, and then you can call it a disease. And most people think, once they get it named, oh, I can relax now, I have such and such.
Now I can identify with this ailment.
Yeah, and make sure they can look it up in a book or on the internet, make sure they have all of the things, they don't want to miss something. So we always want to look at what are the lifestyle factors that were causative of this condition, because there's mostly the lifestyle factors. Certainly there are genetic factors, but we don't have control over those. We do have control over is our choices we make on a daily basis, in which we call the 6 essentials. And these were developed by Dr. Morter, who developed the bioenergetic synchronization technique, which of course is what I practice and teach around the nation. And the 6 essentials are what we eat, drink, breathe, exercise, rest, and think. And I like to look at the choices in quantity and quality. So how we eat and what we eat, how we breathe and what we breathe, because it's those two things, it's the quantity and the quality. So we look at both of those, and as we've talked about before, out of those 6 essentials, our thoughts have a more powerful effect than all the other 5 combined. So we always focus a great deal on how our thoughts are a part of manifesting what we've got right now.
Well, how did the 6 essentials relate to chronic fatigue then?
Well, again, we look at how someone may be making choices. Let's look at eating. If someone's eating devitalized foods, or
let's pretend I don't know what
devitalized foods are.
Yeah,
overly processed, overly processed foods. It's like so many of our foods, like flour. Let's take wheat flour. Originally, wheat flour, if it's taken wheat berries and it's ground and you make bread out of it, great food. But years ago, they started taking the germ out, because the germ is a very healthy part. The bran, the covering, and the germ, which gives you the fiber and the oils, were taken out for one very important reason.
And, to make it last.
So it was economic. Yeah. It wasn't health. It was so it would have a longer shelf life.
Yeah, shelf life, yeah.
It's the same thing with sugar. You take something that's a whole food, it's going to tend to spoil. But you can take white sugar, white flour, put it on the shelf for probably thousands of years, and it's going to be the same thing.
Yeah, we can have Reese's peanut butter cups 6,000 years from now.
So we're talking about foods that were over-processed, overcooked, not grown in organic ways, just all the different things we're talking about. So over-processed, overcooked are the main devitalized.
My wife is on a raw food diet and has been for a while, and she's noticed an increase in energy overall. Absolutely. And better sleeping habits and things like that. Some of our other friends are even more, they're eating live foods. So they'll grow sprouts and clip them off and eat them in the morning.
Absolutely.
And that sort of thing. It's as fresh as you get.
Exactly. So because you're not only getting the nutrients from your foods, you're extracting energy. So there's a life force. That's what we're always talking about. That's what attracted me to chiropractic. And at first was its whole concept about freeing up the life force. Because the life force gets trapped by excessive stresses, and then you're not able to heal, because that is the whole foundation of chiropractic, is that the body is built to heal itself. If it's not doing its job, something's interfering with the process.
I know it's interesting that people will look at a cold as something that will go away, but they don't believe that they can cure something like a joint pain or a toothache or something like that themselves. They got to go to somebody else and get some magic elixir to handle that or worse yet, an operation.
Yeah, and always I try to emphasize that my role is kind of a evolution of what we're looking at as far as what we consider a doctor. I really consider myself more of a detective and a coach.
Yeah.
So
and you also have a more holistic approach to things than
Absolutely.
a doctor who's like specifying one area and that's it.
Yeah, and those are important. If you have a crisis, you haven't taken care of your health, and many times modern medicine can give you some time to turn it around if you use it that way. Otherwise, it's just a dead-end process that leads to untimely and painful death.
Oh, thanks. I got to watch myself. So, well, let's talk about chronic fatigue syndrome and some of the symptoms of that, and it's really a huge subject.
Absolutely. So many, as you said, people are suffering from chronic fatigue because of our overstimulated society. They're not able to sleep well. They're not able to focus. There's depression. There's muscle weakness. There's poor healing. So many things go along with that chronic fatigue because their nervous systems are stuck in a way that's manifesting in this way. Their diets are, again, devitalized. It's not providing the nutrients and the oxygen. They're eating very acidic foods that are producing a very acidic environment, which means you're not carrying enough oxygen in your system. So all these things lead to lower and lower and lower vitality and function.
One of the things we were talking about before the show is I have friends that they tell me they've been diagnosed with chronic fatigue, yet one guy is a fanatical weightlifter and bicyclist and long distance runner and stuff, and so he'll have some of the symptoms like insomnia, for instance, and he may really get tired in the daytime periodically, but it doesn't happen all the time.
Yeah, and you can also push past it, create a little bit more adrenaline. Push past it because, again, we've talked about in the past the role of the nervous system. We're constantly comparing our data that's coming in through our five senses to determine the way to respond to what's going on for our survival, because we're built to survive. So we're constantly bringing in that data, and ideally we'd be responding to that data only and making a response for our survival. But what happens is that we override that data by our past experience. So we're constantly protecting ourselves against what's going on now, against making sure that what happened in the past doesn't happen again.
So you have your known commodity that you want to just hang on to.
Yeah, because you're protecting again, and when you protect, you can't be in healing, because how the nervous system functions is you can either be in protection or healing, but you can't be in both at the same time. So the more someone is in protection, the less they have of energy available for healing. So what happens again is that when you're in emergency response, which is that fight or flee response, muscles become tense, heart rate and blood pressure increase, eyes dilate, digestion, elimination, and healing are suppressed. Because it's not a priority to digest, eliminate, or heal unless you get away from the threat. Those responses served us very well when we lived in jungles because there were a lot of physical threats. But in modern living, most of our stresses are not physical in origin.
They're almost invisible in a way, the bad quality of air, water, food you're eating, and the things we were talking about. Now, one of the things you mentioned in your notes here, depleted adrenal glands and liver malfunction, that sort of thing. Are those things, well, I was going to ask if they were treatable with supplements, because I know there are plenty of supplements available out there to help to beef up your adrenals or whatever. But is that something that could be treated sort of psychosomatically, or is that, if that's the right word?
Well, it's very much like we were just talking about what we demonstrated in our last show when we demonstrated the treatment with you.
Yeah,
we try to find out what is the gunk that's affecting our perception and causing us to treat our experiences if they're a threat. And so we're constantly in that fight or flight response, which is constantly triggering the adrenal glands, which we know that negative emotions, negative thoughts, trigger these responses unnecessarily for what's going on right now. So we're constantly triggering this threat response, and that's going to shut down the digestion, which is going to affect liver function. It's going to keep running the adrenal glands constantly. And our adrenal glands are very, very important glands, because you can only live about 4 seconds without your adrenal glands. You need adrenaline for every single function pretty much of the body. So when someone is constantly in that fight or flight response, they wear their adrenal glands down until it can no longer produce enough adrenaline to function even in a normal way. It's one of the leading causes to this chronic fatigue syndrome.
So, well then let's talk about the process of healing. How does that, what do you do for that? Say your adrenals are so burned out, here you are, you're like falling asleep in the afternoon, you can't really function properly. I know if I get overtired or if I don't eat properly, I can't think clearly. You know, I'll do things like drop stuff or trip over something or whatever, and I can tell I haven't, I'll know, of course, I haven't eaten well, but I'll just see, I better do something now because I've passed the threshold.
And that's, again, one of the things that happens with the adrenals, because when you trigger that adrenal response, it triggers what are called corticosteroids and glucosteroids. Mm-hmm. And what happens is that it causes the pancreas to produce more insulin. And so that creates a drop in blood sugar.
Well, would that contribute to shoot, now I can't think of the thing with insulin.
Diabetes?
Diabetes?
Sure. First it starts as a hypoglycemia, which means there's low blood sugar, and then eventually creates, as that insulin is produced more and more and more, it creates an insulin resistance. The cells can't take in insulin. So then, again, you're not utilizing the glucose, and it builds up high levels in the blood. And then that creates real problems. And so, of course, medically, they give you more insulin to try to force it into the cells, which creates more resistance, and on and on and on.
And would that attack your liver? Isn't your liver supposed to process all that stuff?
Mm-hmm. Because your liver detoxifies, your biggest detoxification organ, does like over 500 different functions that we know of.
Man.
So, that's so important. So
500 functions you know of. I can't.
Yeah.
I think it's.
So all of it comes down, we look at the chemistry. What has happened to the chemistry? Normally, things become too acidic. And so when the body becomes too acidic, it can't carry sufficient oxygen.
Well, if that's the case, do you have to eat more alkaline foods?
That's one of the things. As I'm working with a patient, we look at their choices in the 6 essentials. So we look at the foods. Are they devitalized? Are they eating too much acid food? Are they eating foods that they may be having allergic responses to?
Oh, can we just touch on that for a second?
Sure.
All right, allergies are rampant. I have a lot of friends that just suddenly, like now, the weather's been so odd and people start sneezing, or they have build up of sinus problems and things like that. Is that something that you can work on, mind over matter sort of thing?
Well, again, it's not so much mind over matter as understanding that mind creates matter. Mind influences matter.
Well, that's what I mean, I think. So if you say I'm really thankful that I don't have allergies anymore, will that help?
That will help, but you would say I'm so thankful and grateful for, how would we put that?
I know, it's
not because you don't want to have not.
Right,
I'm
right.
so thankful and grateful that I respond with love to my environment. Or have a very harmonious relationship with my environment.
Good.
We would
Sorry to
create
get off on
something
that
like
tangent,
that.
but
that's okay. It all fits in because the mind is the biggest influence, because it's triggering responses that are, again, going back to those adrenals. Those are the biggest key when we're dealing with chronic fatigue, because the adrenals, when they're functioning properly, they will produce natural antihistamines. They'll also produce DHEA, which is a precursor to all your hormones. It produces some very good chemicals as well. But when it's stuck producing stress hormones and stress chemicals, it can't produce the good ones. So we're constantly in a factory producing toxins rather than things that are beneficial for us.
Well, I wonder if that, DHEA and these other things you're mentioning, that's all stuff that they're, running out as this new magic supplemental thing.
Yeah.
If people would change their lifestyle or change their method of thinking about things, they wouldn't need all the supplements. Their body would naturally produce the things they need.
Exactly, for the most part, because as long as there have been human beings, people ate whole foods, and the innate intelligence of the body knew how to extract exactly what the body needed out of whole foods. Yet in modern living, because again, eating poorly, not getting enough rest, not breathing properly, breathing pollutants, being exposed, our nutritional needs have changed a great deal, and we can't even get the foods in their natural state. We're all running, fast, we're eating on the go. Even those of us who do make better choices, we're certainly not living as close to a natural state as we could be.